So the first step in getting out of back pain is to start mobilizing the spine. The caveat here is that we want to mobilize it in order to rebalance it. In other words, depending on the ergonomics we are exposed to on a daily basis, our spine will be skewed towards flat back, like a flat lower back, or it will tend towards what we call hyperlordosis, which is an excessive arch in the lower back. And so what we'll do now is a test that you can do at home to have an idea of where you stand. So what you will need is a wall, and you want to basically align your ankles, your buttocks, your shoulder blades, and the back of your skull with that wall. And basically, and I will show you from the side, you want to slide your hand behind your lower back in the space that your lower back allows. So it looks like this. So what you will notice is one of two things. Either your hand will get stuck, like you won't be able to go past your fingers, and this indicates a flat back, which is a reduced lumbar curvature. The other option is that your whole hand slides right through it. This would indicate that you have an excessive arch in your lower back, and you may tend towards hyperlordosis. Now, usually when we have a flat back, so if your fingers struggle to pass, usually we tend to be sensitive to movements of flexion. So if that's you, you will probably feel vulnerable when you try to bend over to pick up something. The other option, if you already have an excessive lumbar curvature, and so if your hand was able to pass right through it, is you will have sensitivity towards back bending movements. And so even looking at this might make you feel like a bit uncomfortable. And so if that's you, on the other hand, you will benefit from flexion-based mobilizations. So to recap, you need to know, one, how does your hand fit in the space between the wall and your lumbar spine? Is it passing right through it, which means excessive curvature, or is it stuck at the fingers, which would mean reduced curvature or flat back? And with that, you should have an idea of if you tend to be sensitive with flexion-based movements or extension-based movements. Usually, if we have a flat back, we won't like flexion. And if we have a hyperlordosis or an excessive arch, we will be sensitive to extension. And statistically speaking, most dental professionals tend to have a flat back and be sensitive to flexion because this is what they are exposed to on a daily basis.